In a world where discussions about reproductive health often revolve solely around the mechanics of the sexual act, we are here to widen the conversation. Yes, we will talk about biology, fertility, and contraception, but we will also venture into the realms of emotion, identity, and empowerment. Because let's face it, being a woman is a multifaceted experience. Our reproductive health isn't just about our bodies, it's about our identities, our autonomy, and our place in the society. Throughout this episode, we will explore the intersections of femininity and reproductive health, from the societal pressures placed upon us to conform to certain standards, to the triumphs and challenges of embracing our bodies and choices. So, whether you're a woman navigating your own reproductive journey or an ally seeking to better understand and support the women in your lives, this episode is for you. My guest today is Dr. Venu Agarwal, and she is Director of Obstetrics and Gynecology Department at Cloudnine, Gurgaon. Hi doctor, welcome to the show.
Hello Pooja, thank you for calling me here.
My first question for you and for the benefit of our viewers is, reproडक्टिव हेल्थ में प्रेगनेंसी, फर्टिलिटी, चाइल्ड बर्थ के अलावा और क्या-क्या एरियाज आते हैं?
पूजा, मैं आपको बताती हूँ जो वर्ल्ड हेल्थ ऑर्गेनाइजेशन की डेफिनेशन है, WHO डेफिनेशन, दैट सेज रिप्रोडक्टिव हेल्थ इंक्लूड्स not just having a satisfying and safe sexual life, but also the capability to bear children, and the freedom to have children if, when, and how often or how many they want to have. Okay, so it talks about three things. One is awareness about reproductive health. Second is the empowerment that the awareness brings, and third, the freedom to make their own choices.
Yeah.
So all of this is included in reproductive health.
Understood. So doctor, if you remember the first time we got in touch, and I was just bouncing off some ideas कि डॉक्टर हम PCOS पे भी बात कर सकते हैं, hormonal health पे भी बात कर सकते हैं, and the moment I said reproductive health, you were so excited and your answer was yes, इसी पे बात करनी चाहिए.
Because पूजा, PCOD के बारे में everybody is talking, है ना? There are so many people talking about it. Most people, मैं आपको अपना experience से बता सकती हूँ कि किस चीज़ के बारे में सबसे कम information या knowledge है, ठीक है? With the growing awareness in the society, the changes in the society, I have seen young people exploring their sexuality. Okay, in fact, I'll tell you that earlier, when I started my practice initially 15-20 years back, a young girl would come and then we would ask her, are you sexually active or not? Now, a girl at 18 comes, my question to her is, when was your last contact? So that is how the society has changed or shifted.
Yeah.
But unfortunately, the awareness about it, about how to have, like the definition says, not just satisfying, but safe sex.
Yeah.
That is, the awareness is complete, education is completely missing. So that we need to talk about it. As professionals, as doctors, we are the people who have to spread that awareness. That is why we are here talking about reproductive health.
So, doctor, I totally agree with you that we live in an age where people are exploring their sexuality, but awareness about sexual health is not there. So, thank you so much for agreeing to do this. I think this episode is for every woman, for every girl, and for every man who wishes to know more about this subject. So, thank you so much for that. My next question is, like you said, कि awareness नहीं है. तो इस lack of awareness की वजह से what kind of problems do girls or women face? In fact, आपके practice में I'm sure आप in your day-to-day practice आपको बहुत लोग दिखते होंगे who may be running into all sorts of challenges and problems due to lack of awareness. So can you shed some light on what these challenges are?
So first of all, young people, like we discussed, they know about, because there is so much of information, and most of them are poor sources, I'm sorry to say. They know about the act, but they don't know how to protect themselves. So they don't know how to protect themselves from infections, the sexually transmitted infections. Also, they don't know about contraception or how to prevent unplanned pregnancies. Then, of course, the cancers, like the cervical cancer. So These are the information that they need to know. Apart from that, when they plan to have a pregnancy, they should know how to go about it, and what all they need to do, and how will it impact their health. And all this information, all of this is included in reproductive health.
So it's not just about the ability to bear children, it's also about using the right contraceptives and preventing pregnancies, and if at all you decide to go ahead with pregnancy, how to continue that, and in case you wish to not continue, then how to terminate it in a safe method.
So I'll share a snippet with you. World over, around 50% of the pregnancies are unplanned.
Really?
Okay. So most of these pregnancies, let's say if the woman is unmarried, or she's not really in the space in her career when she doesn't want to continue. So she has two options. Either she will discontinue with the pregnancy, go for an MTP, or she will continue and have this child. The problems with discontinuation is that not just physically, but emotionally also, it can have a major impact on your health. And so the biggest complication that I have seen with an abortion is regret. There is always that feeling of that I did कि मैंने कुछ तो गलत किया. I should not have done it. And not just that, I have seen this trend wherein young girls, if they get pregnant, they go to a local chemist and they will just get the MTP kits, and they don't know how to use it properly, and they land up with problems such as infections, very, very heavy bleeding. They come in emergencies, and and if they have not got an ultrasound done, rarely there can be something called an ectopic pregnancy, wherein the pregnancy is not inside the uterus, but inside the tube. And all of this is like a major drain on their health. So we need to prevent all of these pregnancies. We need to talk about contraception. So who will talk about it? It is us who has to talk about it.
So doctor, like you said, that not enough is being said about or talked about this subject. However, I noticed that in the last few years, some big corporates or big pharma companies are actually talking about women-centric issues. So what is your take on that?
Pooja, I would say that yes, pharma companies may be talking about it, but we live in at least in urban corporate world, it is all about the bottom line. It is about the economic agenda. So I'll give you a few examples. First of all, first one was there was this model or actress. It was declared that she has died because of cervical cancer. The next day, she came up saying that it was fake, and this was just to promote the awareness about cervical cancer vaccine. Now, this was an ad campaign run by the vaccine manufacturers, the pharma companies. I agree, it's very important to talk about cervical cancer. In India, cervical cancer is the second most common cancer after breast cancer. It's the second most common cause of cancer-related deaths in women. But do you know that in the Western world, long before the vaccines were here, they had decreased the incidence of cervical cancer to a great extent only by something called cervical cancer screening. They screen for the pre-cancer stages and treat it before it develops into cancer. There is no talk about the screening. They talked about vaccine, they talked about cervical cancer. Yes, it's important. But did they say that no, the screening is must? Every woman, for 3 years after she's been sexually active or after 30 years, every sexually active woman has to go for screening. From 30 to 65 years, they should go for screening. And this is what will, we can screen and treat and prevent cancer from happening. In fact, did they say that vaccine is most effective for women who are not sexually active yet? It is most effective in young girls. And after 25, yes, they can take it, but it is not as effective. Once you are already infected with HPV, once you are sexually active, there is a strong possibility that you are already infected with HPV. So your chances of getting the infection or this vaccine preventing the infection go way down. It's only 50 to 60%. In fact, a couple of days back, there was a very highly educated girl. She comes to me at 38 years and she says, ma'am, I'm going to be 40. I need to take the vaccine. I said, okay, I'll give you the vaccine. It may prevent some, the problem for you. But when was your last screening done? And do you believe she has no clue about what a cervical cancer vaccine screening is? So that was, for me, that is something that is unfortunate.
Yeah.
A highly educated woman working in a corporate doesn't know about cervical screening.
Yeah. No, I agree with you. In fact, doctor, I learnt about this cervical cancers vaccine, the age criteria. Some time ago, I remember we were looking to organize a vaccination camp for cervical cancer for our women employees, and I started talking to a couple of vendors, and that is when I learnt that after the age of 25, उसकी effectiveness बहुत कम हो जाती है. So they told me कि मैम आपका average age कितना है, of working women, and it was about 24, 25 at the time, and they said actually this is not going to help you much because ये तो बहुत young girls को लगती है before you're sexually active. And I think you're very right in pointing out that corporate-led agendas focus on selective dissemination of information, and unfortunately, women's health is never the main focus or focal point of these campaigns.
True. I'll share another example with you. A few years back, there was, in fact, I'm sure that this ad is still running. They were big time promoting vaginal washes.
Yeah.
Now, vaginal washes should not be regularly used by anybody unless you have been prescribed by a doctor. But most girls who were coming to me would very proudly tell me, ma'am, I use a wash every day. Do you realize that your regular vaginal secretions, the urine, and in fact the semen also has antiseptic properties. They maintain a healthy vaginal flora and pH just without doing anything.
Just with plain water?
With plain water only. In fact, if you use these washes, you are actually destroying that regular flora.
And the pH balance also.
The pH balance also, of course. But it was promoted as if, and they put some substances in the washes. It makes you feel that that fresh feeling, and you feel that you've done something right. But it's absolutely not true. So using plain water for washing the vagina, the vulva, is sufficient. But we are made to believe that if we are not using the washes, we are doing something wrong.
Yeah.
So that is why how corporates disappoint us.
It's so unfortunate.
It is. It is definitely unfortunate.
Yeah. So another question that I have for you, doctor, is like you said in the beginning that the society has changed a lot in the last 15, 17 years since you've been practicing. Another change that has come about is that more and more women are now joining the workforce, especially in urban India. And because of this, they're also delaying their pregnancies and their motherhood journeys. So have you seen any, so I actually have two questions. One is, have you seen any problems going up as a result of these delays, and how does age impact pregnancies, fertility and childbirth?
Pooja, you've come to the second most, something that I really want to talk about. So do you know that the best age, the ideal age to conceive a child is from late teens to late 20s?
Really?
Yes. After 30, the fertility keeps on going down, and after 35, there is a sharp decline in fertility.
Okay.
And not just that, as age after 30 age increases, the pregnancy complications also spike.
Okay.
Do you know that at 25, the chances of a woman having a miscarriage is 8%.
Okay.
While at 40 or more, it is 33%. That is 1 in 3 women will abort if they conceive at 40 or more.
Okay.
It is such a staggering fact. Another fact that I want to tell you is about the genetic anomalies, the problems. At 25, it stands at 1 in 1,000, which increases to 1 in 50 at 40.
Wow.
Apart from that, the problems like diabetes, hypertension, the risk of having a stillbirth, all of them go high. Also, as the pregnancies are getting delayed, the women are getting more independent. They are used to living alone or independent or mostly with their partners in a nuclear family. Having a child at that age, then raising a child, you know, playing with that child, being with them for the next 20 years is something that this, you know, as a society, we should look into that as well.
Yeah.
With delay in pregnancy, fertility, pregnancy complications, all of this is there. But the societal complications, the rates of mental health issues, the
Yeah.
postpartum depression
Correct.
is definitely gone up.
Yeah. No, I agree with you. In fact, when you've been your own person for like good 30, 35 of your lives, and then all of a sudden you're having to sacrifice all of it for a child, it's very difficult. Not everybody can make their peace with it. It can come as a shock to a lot of women. आपको पता ही नहीं है, you know, how to sacrifice your sleep, your routine, your outings, you know, your dates with a girlfriend, and all of this goes out of the window once you have a child. And I think as a result, again, I'm not a doctor, but I'm guessing the fact that women are having kids at a later age might have to do with, you know, more incidents of
So I
postpartum
have
depression.
girls who come back and say, ma'am, my life has completely changed. You know, they used to be the bosses, you know, by, let's say by 35, by 38, they are at very senior positions.
Yeah.
And now here they are with a small kid who's just pooping all day, crying, and they say that I'm like a cow. I just have to feed this child.
Yeah.
But on the other hand, they are worried about going back to the work as soon as possible, doing well in their careers, and they feel that their career is seeing a setback because of the child. So that is something that delay in pregnancy, all of this, delay in conceiving is causing all these problems, I would say.
True. I think it's very unfortunate that the biological clocks of women and their career clocks are inversely proportional to each other. But do you not feel that in a way it is the society that has pressured women into delaying their motherhood journey? Because for a very, very long time, our presence, our merely being on the planet was reduced to just being, you know, childbearing machines. And we were not valued in our families. Girls were not heard. And which is why we felt the need to, you know, be financially independent, go out, make a career out of, you know, for ourselves. So what do you have to say to that?
I so agree with you, Pooja. We still live in a patriarchal society where we see that in most families, the men are the primary decision makers and women are, though they take care of the family, they take care of the house, they take care of everything else, but the financial, because the financial power is in the hands of the man in the family, they are considered the primary person, the first person in the family. So that is why the women had to step out. Even when the girls are growing up, our own kids, we tell them to be equal to men. We tell them to work equally and, you know, be like men. But what we are not nurturing in them, or we are not telling them that it's a privilege, it's a gift for them to be able to be a mother, to be able to conceive. In fact, I have seen a lot of girls, they have a very negative view about having kids. See, yes, it's your independent view, and it's up to you to whether you have a child or not. But it should not be because of how you have been brought up or how the society has put these ideas in your mind. Because like we discussed, having a kid may push you back in your career. Having a kid may make you more responsible at home, and you are able to you must have met a lot of girls who have given up their positions or their promotions because they wanted to be mothers, or in fact a lot of them have given up their careers to be mothers. They should be respected for that. If that is what they want, they want to stay at home, fine, they should be respected for it.
Yeah.
And on the other hand, all the girls should be brought up with telling them that it is important. Being a mother is a privilege. It's a gift that God has given us. So a woman who is able to bear a child, who is able to continue the species, she is the main person, which is unfortunately getting changed.
Yeah.
It has changed over centuries. And now it's the time that the society realizes the importance of women. Being a woman, not treating them or not telling them to be like man. That is my problem.
Yeah. So as a society, I think it's very important to do two things, if I understood it correctly, and I agree with you. Number one is, while we want our girls to be financially independent and we want them to be treated, equal to boys, they are not boys. So उस पे emphasize करना बहुत important है that they're different and what they bring to the table is different, and we need to harness those energies as well. And second is, we should respect a woman's choice, decision, career से related हो, family से related हो, and she shouldn't be judged whether she is a working mother or she is a stay-at-home mom. She deserves the equal amount of respect.
That is so true. A woman is completely different from a man, but she has to make her place in a man's world. A woman undergoes a 28-day, most women undergo a 28-day cycle every month. A man does not.
Yeah.
Their life is like that. For a woman, the life is like that. It
Yeah.
runs in circles of 28 days.
Yeah.
So, in fact, their exercises, their diets, the work that they do, their emotions, everything is different at different times of the cycle. But that is not being recognized.
Yeah.
How many places and how many homes do you think food is cooked according to a woman's cycle? How many places do you find exercises being planned according to a woman's cycle or body? Or if you go and look for an exercise specifically for women, most of them will still be what men are doing. So we are made to adjust in ourselves around a man's schedule in this world. So the society has to support them
Yeah.
according to their needs.
Yeah.
It has to let them be women
Yeah.
and succeed being women. And once we give them that space, you will see so many leaders, women leaders, and they will do so much better.
No, women's bodies are so complex, like you so rightly said. We have a 28-day, menstrual cycle. On top of that, we have our, circadian rhythm. We also have our hormonal profiles, and everything combined makes it so much more complex. And you spoke about, cycling our diet, nutrition, exercise regimen, and aligning it with our menstrual cycles, and that is so important. Luckily, there is more and more research coming out of it, about these subjects. They're talking about seed cycling also. In fact, skin cycling has also become a thing these days. And yes, society, I think, as a whole needs to come together and realize this. At a corporate level, what do you think needs to change to support women and make sure that they don't have to sacrifice this part of their life?
Yes. Unfortunately, as of now, again, we go back to what is happening right now. Most corporates do not want to hire women who are young, who have just got married, and who have plans to have kids in near future. They see them as half a worker.
Yeah.
They would see them as people who need more flexibility, more leaves. They don't see the strength that they are bringing in. So the whole mindset of the society, the corporate world has to change. The mothers are the people who are running the world. They are not there to, they will be, because once they manage their homes, if you see women leaders, they're exceptionally good because they know how to manage so many things. But just let them be how they want to be. Don't compare them or make them be like a man. As we see in the competitive corporate world, the women have to compete against the man. They have to behave like man. Now what is happening is that because of all of this, the masculine energy or the yin part, the aggressive, the go-getter, the part where you have to succeed, the masculine energy is increasing and the feminine energy is not being promoted as much. The feminine energy is the nurturing, the stable, the taking care part. Now, because of this, there is an imbalance. So we have to bring back that imbalance.
Yeah.
For women, we need to tell them that they need to nurture or they need to empower their feminine power, feminine side too. This is a change in the society as well as in the corporate world that I would like to see.
I think, and I can say this with some amount of, authority here, because I've worked in HR for 10 years. I used to handle diversity, equity and inclusion agendas for some of my employers. I think वहाँ पे भी जो understanding है around DEI, around women's needs were at a very nascent stage. So I'll give you an example. So let's say if a woman has kids. So the corporates way of supporting her would be, let's take her off that important project. She may not have the time, she has 2 kids, she may be required more at home. Whereas what a woman would want is flexibility and not be completely taken off that. So I think वो understanding नहीं है of what women need, and which is why I think more and more women should talk about it, because of course we are the best judge of what we need, we can speak more openly.
So I'll tell you, being mother of 2 kids, I will tell you that if there is a mother who has 2 kids, she will be more able to manage things than a man, because she has been taking care of the kids, the family, and the career
You
till
become
now.
a multitasker.
You become a multitasker, exactly. So you are much better at managing stuff than others maybe. So yes, that is something that we all have to do. We have to tell them that it is okay to have kids. That is what my point here is. That if we have to talk about it, we have to promote having kids.
And have them at the prime of your life.
Yes, having kids at the right time. Not delay it because it was inconvenient in your job. It was inconvenient for your company. Because your biological clock is running.
Okay. So doctor, I think the next few questions that I have for you are a bit personal, if you don't mind. Because when I planned this episode, of course I knew we would be talking about fertility and contraception and all the science behind all of this. But the first half of the interview took a very unexpected turn, and we spoke about feminine energy and masculine energy and yin and yang. And I think this sort of understanding or insights do not come to you all of a sudden. I mean, they don't happen overnight, right? And of course, sometimes there are major personal events that we go through that make us re-question everything, re-look at everything. And so what I want to ask is, in your own life, have you been through a personal event because of which you started maybe diving deeper into this whole theme of yin and yang, spirituality?
So our interview is moving towards more personal questions or more personal discussion now. Unfortunately, Pooja, so my career journey, like we discussed, started 25 years back. But my spiritual journey started 12 years back. My career journey was because the driving force behind my journey was my mother. She has been, it was her aspiration that I become a doctor, then I become a gynecologist, and it has been like, we have been a team, and she had been my driving force. And then in 2012, tragically, she had a stroke, and at the same spot, she in fact went for a movie, and she was brain dead. And that was something that, it was like a shock for all of us. But for me, like I said, she was the driving force behind everything I would say. In fact, and after that, I was so lost. I was so, it felt like I'm just floating without really having a purpose or really knowing who I am or what I want to, without a sense of direction. So that is when I realized that I need some sort of spiritual support. When my mother was declared brain dead, and the doctors gave us an option of organ donation. My parents have been very spiritual people for since 1990, I would say. So for 20 years, we have grown up in that environment, and they had been, so for this is something that I thought that my mother would want. A few years back, when my Nanaji passed away, she was the one who wanted to get his eyes donated. So and my dad knew that yes, it's okay to do the organ donation. But few of my family members were not comfortable with the idea. So although I knew as a doctor and as what I had read, I knew that this is the right thing to do. But all these, the people around me, and I was in that mental space where I was not sure. So I wanted to get some answers. So all of this made me search for that spiritual,
awakening.
Yeah. awakening. I was looking for something that makes me feel, there is something to tether to.
Yeah.
And that is when my spiritual journey started. So sometimes I feel that, that passing of my mom initiated me on my spiritual journey. And once, it was not just an overnight thing. Slowly and gradually, I joined few sessions, went to a few retreats, read a lot, heard a lot of people, meditated, journaled, a lot of things I did over the years, and which have kind of brought slow and gradual transformation, I would say, in how I think about things. So I would say that is why all of this I have been able to think about apart from my career. But like as a gynecologist, otherwise it's all about it's a very busy schedule. But the spirituality part has kept me thinking and being more connected
And centered.
more centered, yes, more centered to all of this.
So what was your discovery after you started this spiritual journey?
So first of all, I would say what I realized was कि मेरी priorities क्या हैं. Like I said, 25 साल से it had, like, for the initial years, it had always been the career, my career, then my family, and then my health. When I sat with myself for long hours, I realized that no, my family comes first. My family, people around me, then my health, and then the career.
So
all
the
of them are
sequence was
important. The
opposite.
sequence was complete. What was coming, what I was giving the most importance to should have come in the end.
Yeah.
So, and it's not like it's not important to me, but I know how to take a break. I know what is most important at what moment. So that is something that is a big discovery for me. Apart from that, I've realized that things happen okay, it's okay. Gradually, as you, if you know your priorities, you settle down with them, things happen. Because you put your energies there.
So what would you tell your younger self, your 20-year-old self, if you could go back in time and share
I
some?
would tell myself to enjoy more. Definitely. To have time for your family, for your friends. I would also tell my younger self, like what I'm saying right now, that things will fall in place. You will reach where you are destined to reach. You just keep putting your effort, slow and steady efforts, and you will reach your goals. That is what I would have liked to tell myself 20 years back.
And would it be the same thing you would say to all young girls out there as well?
Yes, why not? I would want to tell them that they need to prioritize what they really want in their lives. In this rat race that we have been running, it's a hamster wheel. Trust me. You don't know what you are doing most of the times. Why you are doing it? You just keep on doing stuff, one stuff after the other, whether it is giving you that happiness or not. So this is again something that I realized. When my mother left us, I had 2 kids. I was doing well in a good hospital in Gurgaon. My husband, my family, my home, everything was perfect. But I was not feeling happy. There was something that was missing in me. That was my happiness. Because what was most important was to get stuff done, rather than focusing on what I want. So that is what you need to realize. I would tell young girls, and maybe my younger self is this, that be sure what you want in life. And then put all your energies into it. Prioritize, make a plan, and you will reach there. Slowly and steadily.
I think another thing that I would like to tell all young girls is that it's okay to not know everything. Take it like one step at a time.
Exactly.
It's okay to not know, and sometimes what you know may not be the right thing, and it's okay. That also, you don't have to be right also at all times. So pause, reflect, take a step back, recalibrate, and while you do all of this, don't forget to live your own life, because that happens only once.
Exactly.
Right? Career and everything, I think, will fall into place That's okay. That's just one part of our life. It shouldn't be our whole life. Just like we said, you know, our ability to bear children shouldn't define our whole identity. Similarly, career alone shouldn't be our whole life. So that is what I would say. So doctor, my next question to you is, if a woman wants to plan a child, are there any particular tests that she can undertake to assess where she stands on her reproductive health journey?
Pooja, I want to talk in detail about this topic here. So first of all, according to the American College of Obstetricians and Gynecologists, there is something called reproductive life planning.
Okay.
And we can very well use it in our setup also. Every sexually active, reproductive age woman needs to question herself. Is she planning a pregnancy this year or not? So yes, if she is planning her pregnancy, then she needs to meet the doctor, get her fertility tested. So first question is whether she wants to plan a pregnancy or not. Okay, so she goes to the doctor, gets herself tested, and see where her fertility stands, and go about it. There may be some tests to be done. We do some fertility tests. We do some tests to some genetic tests, then certain infections. In fact, the test would be for the patient as well as for the partner also. And then after these tests, we may give her some medicines as well. So once all of this is done, then she can go ahead and plan the pregnancy. However, if she is not planning to have a baby, then she needs to use contraception.
Okay.
Okay? Because like we discussed, having an unplanned pregnancy is the biggest problem. Is the biggest problem in the time of their life and in physically as well as emotionally for them. The other thing that I want to say is that when you decide, like you asked me, what are the tests that they can do? There are some blood tests that can help her. Sometimes when ultrasound can also help them. And apart from that, when they decide that when they are, let's say after a couple of years or 3 years, they have to keep one thing in mind. A woman has a fixed number of eggs. They may not know about it. Okay, a woman, when they are born, have a fixed number of eggs in their ovaries, and each cycle one egg is getting secreted. And so once she's hit her puberty and she's getting regular cycles, she's ovulating one mature egg every cycle. Around 300 to 500 eggs are secreted throughout her menstrual life. So after 30, the number of eggs, the number of ovulatory cycles go on decreasing. And that keeps on, and also the quality of eggs.
Okay.
The best eggs get secreted faster, of course. There is always a competition, the survival of the fittest. So the best eggs get ovulated early. So the later they plan their pregnancy, the quantity and the quality of the eggs will go on decreasing. So that is why we say that fertility declines suddenly after 35. So she has to keep this in mind, that if she wants to plan a pregnancy, ideally it should be prior to 30 years, but if not, at least before 35.
Okay.
And there are some tests available, blood tests available as well as ultrasound, which can give us a fair idea where her fertility stands.
Okay. And do these problems actually go up for women who have, say, hormonal imbalances or PCOS, thyroid?
Yes, with PCOS, many eggs are, they grow together, but none of them reach the maturity.
Okay.
So a lot of them are wasted together. So you must have heard from your friends who have had PCOD that their gynecologists tell them that please conceive early, because they are losing more eggs than somebody who is having regular menstrual cycles. So they are losing more eggs. So somebody who is PCOD should actually start planning even a little earlier.
Okay.
So earlier rather than later is what they need to keep in mind.
Okay. Doctor, are there any misconceptions or myths related to intercourse, contraception, pregnancy or childbirth that you would want to talk about?
So one of the main misconceptions I want to highlight here is about the oral contraceptive pills.
Okay.
Every girl who is sexually active needs to use contraception. So I get all kinds of girls, patients who are, somebody would say that, ma'am, we are comfortable with natural methods, which is pull-out method. But its failure rate is around 20%.
Okay.
Sometimes they say, ma'am, we use barriers. Condoms have a failure rate of around 11%.
Okay.
While the contraceptive pills in regular use have failure rate of less than 1%.
But do they not have any side effects at all?
If for a young, healthy, normal average weight girl who does not have diabetes, hypertension or any other medical issues, who is not a smoker, they are absolutely safe.
Okay.
In fact, for many a times for girls who have irregular cycles, who have acne or many other issues, we use these contraceptive pills for their non-contraceptive benefit as well. And in the West, girls starting from 15 years keep on using it for many, many years. All you have to do is come back for a health checkup once in a year.
Okay.
That anyways everyone should do. And check test for any problems that you may have, and then we shift, if needed, we shift them to a different pills.
But does having oral contraceptive pills for such a long period of time not make it more difficult for a woman to conceive if and when she decides?
No, that is absolutely a myth. Like I said, there are many myths around the oral contraceptive pills. So, in fact, for some girls who have irregular cycles, women who have PCOD, many a times we give them contraceptive pills. And they come back with rebound fertility.
Okay.
So, this is completely a myth. There have been multiple generations of these pills. So, we use very low dose pills now and they are very safe. In fact, it is absolutely not related to weight gain also. It's absolutely safe.
No, I think somehow girls are more comfortable with taking these morning pills that they take after having accidental...
Morning pills they are called emergency contraceptive pills.
Okay.
And they should only be used in emergencies. So there are girls who say that we use 2 to 3 pills every cycle. And that was shocking for me to hear. Most you can use it for maybe once or twice in a year, not 2 to 3 times in a cycle. In fact, one tablet has the medicine of 10 contraceptive pills in one tablet.
And what are the side effects?
And they cause irregular cycles, and they are not even that safe. Their safety is just 80%. So I get girls who say, I took the morning after pills, but it did not work because they are not that safe in terms of preventing pregnancy. And they cause irregular cycles for a few cycles. And they have much more hormone. For people who are unmarried, who are absolutely, who do not want to plan a pregnancy, I would suggest, it is recommended in fact, that they should use 2 contraception. One, condoms to prevent pregnancy as well as to prevent infections. And second, the pills. All couples who are planning to get married, I think before they make an appointment for getting their dresses done or for booking the place to get married, they should visit a doctor for contraceptive advice. There are so many couples that I see, at least there are so many of them. I don't have the exact number, but they come back in the first or the second month after getting married with a pregnancy. Many of them are forced by their family to continue with this pregnancy, but some of them discontinue it. So, for all these people, using oral contraceptive pills is absolutely safe. So, this is one myth I want to clarify. It's absolutely safe to use pills for a regular health woman. For somebody who has some complications, there are other methods that can be used. But contraception is what I want to point out. Contraception, preventing infections, and planning pregnancy when they want to. If few messages they want, one message they want to take is, please use contraception, please plan a pregnancy when you want to. That is very important.
Yeah. And are there any misconceptions regarding pregnancy also?
Misconceptions about pregnancies, so like there are so many misconceptions that like if I start talking about it, we can make a whole episode about them.
No, I remember having been through 2 pregnancies. Nariyal khao, bacha gora hoga, ye mat karo, chai mat piyo.
Like I said, it will be a complete episode if we talk about misconceptions in pregnancy. All I will tell you is, your doctor knows what they are telling you. Please listen to them, talk to them. Make a list of all the things that you have heard from your friends and clarify with your doctor in your next visit in pregnancy.
So doctor, I had gestational diabetes during both my pregnancies. And while I did monitor my sugar levels for a bit after the first and second time both, I realized that after my second pregnancy, my sugar levels were still not, in control. So normally, how does it work? Matlab, do you go back to your, pregnancy sugar levels after the delivery? या उसको manage करने के लिए you have to put in more efforts?
Most of the times, around 80-90% times, you will go back to your usual sugar levels.
Okay.
But you will still, in the next 5 to 10 years, you have a high risk of developing diabetes.
Okay.
After you have delivered the baby, 5 to 10 years में, you have a higher risk of developing diabetes. But for some girls, it may continue after pregnancy also.
Okay.
So you have to work on your weight. You have to work. You have to do the exercises and diet, and rarely you may have to use the medicines also.
Okay. So doctor, I agree that people do have a lot of myths around contraception, especially women. But vasectomy is also another way to prevent pregnancies. So what is your take on that?
Vasectomy is the permanent method wherein it is for the males, wherein we block the tubes that supply the sperms from the testes to the penis. Okay, so we block the tubes there. Now, this is like a rampant myth that it will decrease their erection or ejaculation capabilities. Again, like I said, it's a myth. Because sperms are only a few microscopic cells which are blocked. Okay? And vasectomy is much more safe than tubectomy, which is blocking the tube for women. If we need to block the tube for women, it is a major surgery. It's a laparoscopic, mostly done laparoscopically now. It's a major surgery where the woman has to stay in the hospital for a day or two. For men, it's an OPD procedure. These days, what is done is called the non-scalpel vasectomy. You go, you get the tubes blocked, and you come back home.
Okay.
Within a few hours. Okay, it's not even a scalpel is used. So it's that safe.
Okay.
And it will not decrease your capabilities of having an intercourse in any way. That's a very important point that you have brought up. We need to tell them that it does not impact their ability to have intercourse at all.
Okay. So, we've spoken enough about women, their reproductive health, biological age, challenges, etc. I want to now, shift the focus to men, because we also spoke about vasectomy abhi. So, in men, number one, my first question is, has their fertility in terms of, sperm count has also gone down over the years? That's my first question. And second is, what is the impact of the environment on a man's fertility and sex drive?
So there have been studies which say, one, the semen quality and the amount over the decades has gone down.
Okay.
And not just that, the sex drive and the number of times a couple used to have intercourse, that has also gone down drastically. And there have been, the reasons that have been suggested are the increased stress, the long working hours, then use of laptop, excessive exercise. In fact, using these muscle building supplements has also caused problems with the semen quality.
Okay.
So yes, for men, again the fertility has gone down and it may be attributed to the lifestyle changes that we are seeing in the society. And as far as the fertility age for men goes, for men after 40, the fertility has been seen to go down progressively.
Okay. So doctor, as we come to the end of this conversation, I have just one last question for you. And that is, of course, what can be done at an individual level and at a government level or maybe at an institutional level to spread more awareness about reproductive health?
From the government level, we would want them to have clinics like sexual and reproductive health clinics. These such clinics have been a part of regular, in fact in many parts of the city, in Western world, many parts of the city have such clinics wherein people can walk in, get condoms, get contraceptive pills, get advice regarding contraception, get themselves tested for STI, sexually transmitted infections, and get advice regarding contraception too. Such clinics need to be established here as well, especially in the urban centers. Apart from that, we can have regular sessions, sex education sessions at schools, at colleges, and sessions at corporates. You know, the big corporates. They should be professionals who should talk about reproduction, reproductive health.
True.
So this is my vision that every person who gets sexually active is already informed about sexual health prior to being sexually active, so that they are empowered and then they are aware and empowered to have a healthy, safe and satisfying sex life, as we discussed in the beginning.
No, I totally agree with you, and especially because I think with educating kids in the higher classes in school and college, I think it's even more important there, because while they may start seeing reproductive development, it may not match their cognitive development, and as a result they may not be in a position to tell right from wrong. And I think this is where, you know, adults, teachers, doctors should come together and help them spread awareness so that they can make the right choices starting from a young age. And for me, of course, as an HR professional, this has been one of the biggest learnings from our conversation, that, you know, our women-centric, women health care, you know, checkup camps that we provide for should go beyond just breast cancer screening. It should go beyond the regular, you know, tests that we do every year. And we should be talking more about reproductive health, because if we truly want to be inclusive, then we have to, you know, not only accept but also celebrate this part about women. So thank you so much for sharing your insights. It was truly educational, insightful and lovely talking to you. And thank you so much for making the time.
Thank you so much, Pooja. It was immensely satisfying to talk about something. Like I said, it is something that I really truly want to spread awareness about. Thank you so much for calling me.
Thank you.